Social Care Review Group. Start off with the usual admin stuff. The meeting will be live streamed to the public. Recording of the public part of the meeting will be available on the council's website within 24 hours. Any remote participants using Teams, please use the hands up icon for questions and comments. Turn your camera on and microphone on when speaking and off when finished. With members of officers, please remember to switch their microphone on when speaking and off when they are finished speaking, and speak directly into the microphone. Any mobile phones, please place in silent or switch off. Okay. Any apologies for absence?
Yes, Chair. Apologies from Councillor Isles, who's being substituted by Councillor Hussain.
Thank you. Minutes of the meeting of the 30th of July. Anyone have any comments? Are those okay? Okay. Any disclosures of interest?
None, Chair.
Urgent business?
Again, none, Chair.
References from committees and other bodies?
None, Chair.
Okay. I have nothing to report on since the last meeting, which I think means we can go straight into item number 7, the report of the Luton Safeguarding Adults Board 2022-23. Who is presenting that report?
Hello, I'm Beverly McConnell. I'm Strategic Business Manager for Luton Safeguarding Adults Board. And as you'll see from the papers within the pack, I wrote the report on behalf of the Safeguarding Adults Board and the 3 statutory partners. So the Safeguard Adults Board are required to publish an annual report, which must reflect on the effectiveness of its multi-agency safeguarding arrangements in the local area. And the report that you have within your pack sets out how well the local Safeguarding Adults Board achieved its objectives in 2022-23. So within the report, it has to set out, according to the Care Act, what it's done to achieve its objectives, how it's implemented its strategy, what each member of that board has done during the year to implement the strategy, and the findings of the reviews arranged by it under Section 44 of the Care Act, which are known as Safeguarding Adult Reviews. And so the reviews that were ongoing at the end of that year, whether or not they began in that year, whether they were published, and what they've done to implement the reviews of findings, and what it's decided to do during that year if it does not implement a finding review arranged by under that section, and the reasons for that decision. So there's a number of requirements that are set out within the Care Act. And in terms of this report, it has been signed off by the LSAB Strategic Board, but the SAB is also required to ensure that it's sent to the Chief Executive and Leader of the local authority, which establishes the SAB, and it is seen by yourselves for scrutiny oversight, for information and for you to understand the work of the board during the period under review. So the report itself is self-explanatory. It sets out an introduction from an independent chair who sets out his view of how well the arrangements have worked. And if I can draw your attention to the executive summary, which begins at page 3, that sets out what our core duties were and the key findings. And as you'll see from the report, the board agendas have contained a presentation of assurance reports as anticipated in the strategic plan, and they receive reports around how to work with cybercrime, domestic abuse, emotional wellbeing and mental health, and most importantly, implementing the learning from safeguarding adults reviews. Another key factor within the 6 safeguarding principles is around making safeguarding personal, and the report sets out how well the board has worked in that regard. It also sets out the board governance and structures, how it holds itself accountable, and how it has worked to make improvements on practice from what it's learned from experience. So you'll see from the report that there's been a robust interrogation of performance data that it had received, which continues to be a feature of the board, and it's an area of improvement that the board wishes to continue. And it also set out within the report Safeguarding Adults Review published in the year, and you will see within the report that we published a Safeguarding Adults report in review of Adult Tea, where the key themes were around self-neglect, alcohol misuse, and what we would now call mate crime. So we also undertook an integrated SAR domestic homicide review, which wasn't concluded at the end of the year, but which we included learning from that, and is currently with the Home Office awaiting review and evaluation for publication. But one of the things the board wanted to set out was how well it benefited from family members and also the subjects of the SARS in understanding how agencies work with them and then how to make the improvements to achieve the agreed outcomes. So it's monitored the implementation of its recommendations from a board review and other learnings such as its audits, and it has understood and looked at themes around Section 42 timeliness, Mental Capacity Act, legal literacy and cultural competency. Overall, the SAB has increased its communication of what safeguarding is through planned campaigns and provided training around the role that people can play in providing support and advocacy to enable a person to disclose the harm or abuse they may be experiencing. As a final section of the report, the board sets out how well it's done it, what it thinks its self-evaluation is, and the recommendations that it will bring into the next year, i.e. this year, 24-25. And you'll see at page 5 a summary of the recommendations, specifically how it's going to address it through its subgroups. And one of the things it set out is for new metrics for its scorecard, for the joint case review group to actually do an evaluation of the impact of the SAR activity against the SARs it had conducted in the previous 2 years, a further review of rapid reviews held in previous years, and that they were going to conclude and publish the ongoing reviews. It looked to implement revised structures and evaluate the effectiveness of delivery plans and see that they oversaw the LSAB strategic plan and evaluate its effectiveness and whether it was making the changes required. And within Joint Learning and Improvement Audit Group, they agreed that they would undertake further audits, and they set out a specific schedule for audits and what they would look at and when. And then the board itself agreed that it would review its strategic vision and direction, holding partners to account for their contribution in safeguarding effectiveness. So the report is there for your information and for your consideration of what the LSAB has done throughout the year. I'm sure that myself or Jill Britton and Sam Parker are also here would be willing to support any questions that you may have about the report itself.
Thank you, Beverly. It's a very detailed and very thorough report. So yeah. Thank you for everyone for producing that and bringing it to us. Does anyone have any questions? Councillor Hussain.
Just a question in terms of, I haven't read the 312 pages and you're trying to make an effort of it. In terms of people that are in the residential after the Winterbourne scandal many years ago, is the Safeguarding Board satisfied that those people with learning disability are safe enough in those places?
It is, and unfortunately passed away. And through that, there was assurance about that there was learning from that and that was being implemented. In terms of care markets and actually work with care homes themselves, it might be I don't know, Jim, if there's anything that you wanted to add, because the board does have a 6-monthly report about care markets. And during this period, there was nothing within that care market report to suggest that people with learning disabilities in residential homes were at risk during that time. No cases were brought forward, so to speak. But if you wanted to add anything.
Nothing significant to add, but I mean, obviously this is the year 22-23, and as Bev said, the care market reports do go into the board, certainly from an operational safeguarding, and we actually have quite low levels of referrals in for the learning disability area, but they are dealt with robustly, and we do work with our quality team as well in the CQC. So, and we've actually, in the last 12 months, although this slightly a jump from this report, has a new post, which is kind of strategic safeguarding social worker, which is a really partnership approach with a quality team to bring safeguarding in the provider markets that bit closer operationally to kind of help perhaps spot any of those elements as well. We also do a lot of community doles in Luton. We're one of the leaders nationally in community doles. They're doles that are undertaken where a person might be in supported living accommodation, often frequently are learning disability. So we also have those eyes quite robustly in Luton as well.
My concern really is that, do we actually monitor it? Do we have anybody monitoring from the local authority point of view, so that we'll be satisfied something that what happened years ago does not ever happen again? That's what my
yeah, absolutely, Councillor Hussain. So any local authority placement is monitored by our quality team and also by the regular visits from their social work colleagues. So that is monitored, throughout the year. And in addition, if they're in 100% health-based funded place, which actually in the majority of those at Winterbourne were, then the ICB also has a quality team, and they would similarly monitor those placements and schemes. And we have a large Bedfordshire-wide group which manages the quality of anyone under care, treatment and education needs, which all of those type of individuals with those kind of needs would be under. So there's a lot of scrutiny. Yeah.
Thank you. Is there anyone else? Councillor Mead.
Thank you, Chair. This is just in the by and by of the report on domestic abuse, page 24. There's a sharp rise from 24% in first quarter to 78% rise in fourth quarter. What is there? Is that some sort of statistical blip, or was there really that amount of increase in domestic abuse in that time?
All of them would have been safeguarding referrals. Many of those referrals would have been referrals that came in that were triaged through the MASH, but didn't then meet the safeguarding threshold. So it's only part of the picture.
So I think we need to look at this chart actually, because I think it's a little bit misleading. So the labels are really that helpful. So that percentage increase isn't the number of domestic violence concerns that we had as an overall proportion of the number of concerns, which is how it looks. I think but we'll need to scrutinise. I should imagine it's the number of concerns that then led to a safeguarding inquiry. And that did increase because we actually talked with our partners about sometimes we were over sending in concerns which actually didn't warrant a concern, and that's what happened during that period. So I think we just need to look at that chart and make that clearer, because I think it's a little misleading in the way it's presented.
Okay, I have a couple of questions and comments. So a question about the recommendations. It's obviously talking at a single agency level. Is there any, how it's, I think what I'm trying to get at is, how is the multi-agency partnerships, how is that working in safeguarding? Is that something that's going well, or is there weaknesses in the multi-agency partnerships?
Sorry, sorry. So I think if you look at the overview from the independent chair who scrutinises, you can see that one of the things that has been noted year on year is the growing strength of the partnership and how well the partnership works together. And I think we are quite fortunate in Luton that our partners are very on board with us. There are some areas of practice where we have to highlight and raise challenges at the board, but there is generally a really good response, and any area of practice that we feel is going to prevent the board from meeting its statutory objectives, we place on a risk register, and we track that every quarter. And predominantly, those risk register items don't stay on the register very long, because the partners have a real commitment to make sure that safeguarding is effective in Luton.
Thank you, Richard. Yeah, so I think what Bev said is absolutely right, but to kind of like confirm that, and for us to really get a grip of any areas that we may want to improve, the East of England ADAS region is looking particularly at the function of safeguarding adult boards, and we've asked for the ADAS and partners in health and care to come and give us an independent overview. So that will give us an opportunity to see which areas are working, you know, in comparison with other areas, because it's very difficult to see that from the inside. So they will be able to come and give us that independent view of any areas that we might want to strengthen in terms of our partnership, and any areas of good practice that we should be celebrating. So we're looking forward to that, and that's likely to happen at sometime in the next 6 months or so. We haven't got a deadline, but they're just kind of making the announcement now.
Thank you. So I think I just got one more comment to round off. So yeah, just to follow on from that, since it's good that the agencies involved, most of them seem to be aware of the challenges or areas where improvement is needed. I think that's detailed in the summary of partnership achievements. So I mean, are you happy that, say, all of the agencies are aware of those challenges and of the challenges that they face, and what they need to do to improve?
I think that's one of the things that we do throughout the year. As you can see in the report, we don't just move from strategic board to strategic board. We have a development day at least once a year where we look at what we have said in our strategic plan and our delivery plan, how well we're working against it, and actually have those really robust and open, challenging conversation with partners to say, okay, so but what more can be done? And there's going to be within the next report that we will bring forward for 24/24, there's going to be further evidence of how we've looked at that, more reciprocal arrangements, more involvement with some of the voluntary sector, and charity organisations around particular themes. So some of the issues that have come out are around drug and alcohol use, safer accommodation, and also the board has recently been written to by a ministerial letter around rough sleeping. So they will be all items that the board will look at and look at the challenges of working at together. And within the report, you see that one of our objectives was to actually recreate what used to be a VARAC group, but is a critical adults safeguarding arrangements panel, where we could look at some of those more complex high-risk cases as a partnership and work out together in a multidisciplinary setting exactly what is the best support for those individuals on an operational basis. But the board has oversight of that policy and procedure and making sure that that works robustly. So I would say that they would have good oversight of the challenges.
Okay, thank you. We're asked to note the findings and future plans of the LSAB Annual Report 22-23. I think we can do that. So thank you very much. We move on to item 8, Carers Strategy Update. Is that Jill?
Thanks, Richard. So colleague Stephen Falvey is going to introduce the report.
Hello, I'm Stephen Falvey, Senior Integrated Commissioning Manager, working in adults commissioning, population wellbeing. I'm just going to give an overview of the report. So the document provides an update on the implementation of Luton Carers Strategy, which was approved in June 2023. And it sort of outlines progress made in the past year. And the strategy focused on improving the support system for unpaid carers and recognising the valuable work that's undertaken by carers in Luton over a 5-year period. So there's been positive developments that have been made over the past year. Further work is required of the remaining 4 years of the strategy. And I think a key focus, which is in the report as an appendix, is the refresh of the strategy implementation plan. So it's been updated with strengthened actions and new measurable key performance indicators to better track progress and outcomes. So looking at some of the key achievements of the first year, so Carers Central, which is our commissioned support service, and the service, it's really grown, and the support service now supports over 1,778 carers, offering a dedicated website, virtual contact centre, and also face-to-face support. And also we've established a Carers Partnership Board over the last year, and that's established to oversee the strategy implementation. That involves key holders, various key stakeholders, including carers, to ensure collaboration. We've also developed a new carers portal, an I Am a Carer portal, which is available on the council's website. And this was launched to provide easily accessible resources, including support links, a directory of services, and an online carers contact form. The report also includes the findings of the National Carers Survey, which is run every 2 years. And there have been notable improvements, which was an increase in carers' inclusivity and access to information. And this is likely due to Carers Central's effort and growing partnerships. But also there's been some challenges where there's been a decline in the reported carer-related quality of support, social contact and satisfaction with support services that have been noted, and these areas will be targeted in the forthcoming year. So the year 2 focus, the second year of the strategy, is going to be focusing on enhancing carer support services, particularly around social contact and wellbeing. Carers Central will extend its capacity, while new carers forums will be created to encourage co-production and enable carers to shape services. And also addressing the decline in satisfaction with support services, this will be a key area for improvement. And we intend to run a local survey at the same time next year to measure the impacts and actions and carer satisfaction as we implement further actions within the survey, the strategy.
Thank you very much, Stephen. That's it, is it? Yeah, thank you. Okay, does anyone have any questions? Councillor Hussain.
I might have missed it, but In terms of the young carers, can you tell me any specific area that where the young carers are particularly supported for their role? Because I might have missed it in this.
So we have, with called Chums UK, which is dedicated for support for young carers, and also we've actually got a specific action within the action plan for year 2 to develop the support specifically for young carers. We're linking in with Carers Central, our organisation, and I just need to find the action. But we're also linking in with our colleagues in children's services too, and I think it's about actually looking at the transition as well for older young carers as they enter the carer service. So there's that link, but it's definitely on the agenda for year 2 of the strategy.
I think specifically in terms of young carers, is the appreciation also in terms of the respite. Do we do anything at all in terms of that, where the young carers are looking after an adult? Also, do we do anything in that, supporting them?
So I think we would need a children's colleague to advise on that. This is the adult carers strategy. And so I think for that specific question, I can take that back to children's colleagues and we can provide a response by you.
Because I think it's very important, because they play a very important role.
They absolutely do.
And
I think,
with their health, we could have a number of people that would be coming into a full-time care.
Yeah.
In terms of the adult care, in terms of recognizing the huge contribution they've made to not just to Luton, to every local authority in the country, because if we didn't have them, every local authority would be bankrupt. So I think that needs to be highlighted. I know it's a fantastic strategy and all that, but having it at least once or twice a year, recognizing their contribution and, inviting them to come, to some sort of a recognition and, saying that thank you very much for the important role that you have made.
I think with care centres as well, we'll be working very closely looking at national carers sort of recognition sort of events. So, for example, Carers Week and also Carers Rights Day. And we'll be using those opportunities to sort of celebrate and recognise the sort of the key work that carers undertake.
Councillor Chowdhury.
Right. Thank you. Thank you for your report and the strategy. What I really wanted to ask around priority 1, the need for early identification of carers. We know that Luton has a big group, big community where, they're hard to reach. Most of the carers are usually family members and they have language problems, etc. How would we be identifying them? Is that only through our known professionals who actually go into the homes? Are we missing people? And the other thing is, in terms of the support, you're talking about the app or the website. How do people with language problems or lack of digital skills actually access that support? Those are my 2 questions. Sorry.
I think we're going to be undertaking a really sort of targeted awareness raising campaign in year 2. Again, working very closely with Carers Central, undertaking a lot of work of all avenues to reach and identify those classed as hidden carers. So, for example, I think within there as well, actually, we've just revised the services specification to ensure that they are going to target specifically underrepresented groups and reach out to those. So there's going to be an outreach program as well to try and identify those. Again, I think it's about looking at, I suppose it's like one size doesn't fit all. So it's how we actually sort of target those carers and their needs to support them. That's why we want to sort of widen the sort of the platform of avenues for people. Again, it's about a huge publicity drive as well to raise that awareness. So not just online.
So will we be monitoring that to see how effective our targeted approach is?
We do.
And I'm especially concerned around respite as well, because if we're not identifying carers who are there in the community supporting sort of our disabled adults and providing that much needed care, it's about their own well-being as well, and how we're supporting them. Are they aware of the respite support that they can obtain from the local authority as well?
So we're actually, Care Centre now are actually reaching out. We're linking in with the Carers Partnership Board. We've got quite a wide range of stakeholders that attend the board, which is monthly. And Care Centre are working very closely now with hospitals and faith groups, GP practices as well, to sort of identify those carers to ensure that they are aware of the offer that we do provide. And what's key is actually to have the carers assessment to assess their individual personalised needs, and then targeting a support plan to meet those needs.
Sorry, at the moment it's not working because it's online. People are having problems accessing that sort of, they're required to do the assessment themselves. If they've got lacking digital skills or have language problems, they're not able to do it themselves. So there is a sort of a problem around people accessing those services at the moment.
Sorry, so we've got a range of ways of taking a carers assessment at the moment. There is on our online portal. You're quite right, but you can also phone customer services, and you can have a carers assessment. In fact, most of them are done face to face with a social worker, so that is possible. We're also rolling out trusted assessor training with Carers Central, so that they'll be able to do that, those assessments too. And as I say, they're working closely with a whole range of other voluntary sector organisations and with health professionals to increase the awareness and the ability to kind of recognise carers' needs and be able to support them directly or forward them onto the best means for them as an individual, what they want to take up in terms of having a formal assessment, if that's something that people want. So there's lots of different ways to get through, and we are actively trying to increase that and promote it. And this is a key part of our implementation strategy that we're basically are putting before you today.
Can I sort of pick this up outside the meeting? Yeah, in terms of the queries I've had regarding access for care assessments and care assessment as well. Yeah, thank you.
Councillor Begum.
Thank you for the report, and I'm happy to see the progress that's been made. I have a question, actually two questions. One, I'm glad to see there's on point 11, page 66, that about the ethnicity, the range of ethnicities you've reached, but there is also quite a lot that we haven't reached. That's not clear on this report. The other one was, and that would lead to the second point, is on, you said about awareness with voluntary and community organizations, and is that did you hold 6 events with 10 or more attendees? Is that, and where were they hosted? I didn't know anything about it.
No. So this is planned events. This is our plan. This is our implementation plan. I don't know how many events we've had at the moment, but that's how many we expect from our contract on an annual basis. And we've just relaunched that contract with them. So you haven't missed anything. I think that they've not necessarily taken place, certainly not all of them at this point. What was your second point? The point about ethnicity, I missed it. So couldn't quite catch it.
I think that will lead to the second question. So I wanted to highlight that point into the second question. Obviously, you haven't hosted the event. Which voluntary organizations are you working with? Because there are a lot of organizations in Luton that are working with as Councillor Chaudhry said, hard to reach and do translate for a lot of carers, a lot of people who come with it. For example, CYCD. So are you working with them to maybe host one of the events there? So that would help you to reach more ethnicity of that we haven't covered in that report.
Oops, sorry, that's it. I don't actually have the list with me now, but I'm happy to provide that. But the Carers Central are actually continually sort of to expand their diverse sort of partnership network that they're working with. And currently that stands with 191 partners, of which I don't have the names here, but they can be provided. And I think, again, I suppose it says that as part of their marketing campaign, that there will be a campaign of leaflets, posters to contribute to community venues, GP surgeries, and also leaflets being delivered directly to households. And there is going to be in year 2 as well a sort of communication plan as well. Carer Central will provide us with quarterly monitoring reports that provides an update of how they're developed and also the targets and the KPIs that they're reaching. But also, as I said just earlier, within the specification for the next 2 years of the service, we've sort of enhanced that as well to reach, as I said, sort of targeted and representative groups as well. And they will report back on those on a quarterly basis as well.
Thank you, Chair. I think as a suggestion, I know Carer Central doing great work, but it might be worth linking with community organizations that are probably not with Carer Central. So because I work with CYCD, that's where I don't think CYCD is aware of it. So this is where I'm coming from to say, if they were aware of it, there's a lot of people that you might find out that they are actually carers, that we don't know that they're carers. And this is leads into Councillor Chaudhury's point of, due to the language barrier and the stereotype and stigma around looking after our elderly, they don't even think themselves as carers. So that's the reason, as a suggestion, maybe going into organizations like that. Thank you.
Councillor Mead.
Thank you, Chair. Getting back to Councillor Hussein's point about young carers, one hears quite horrendous stories of pre-teen children looking after family members with alcohol, drug, mental health issues. Are we sending out to the schools to look out for children who could be in this situation? You know, they may be falling asleep in the middle of lessons, not because they've been on a computer all night, but because they've been struggling at home. Are we taking active steps to identify children in Luton who could be in that position?
Is this a children's services issue?
I'm really sorry, but I'm not able to provide the detail of what children's services are doing to promote their needs and reach out to young carers. As I say, this is the adults report. I'd hope in future that we have a much more joined up all age strategy, but at the moment that isn't the case, and the strategy was published 12 months ago. But I will speak to children's colleagues and put both of your questions to them so they can answer to Scrutiny via that route, if that's helpful.
Councillor Hussain.
With all due respect, Jill, that I always believe is a one council, and we can't talk to our colleagues in the council. How do we expect to realise where the problems are? And I would find it totally unacceptable that we're not talking to each other and realising that there is a problem. And I thought there was a protocol between the two services to be able to talk to each other if there is a child who is looking after an adult. You know, a child does not mean to say school age. We're talking about a college or even a university, right? So I think we need to be working very closely with them. There was a protocol. I'm not too sure if it's still exists, and if it doesn't, it should be.
So
that's not past the bucket.
No,
So,
not.
Councillor, can I just come in here? So I appreciate what you're saying about people working together, but I wouldn't expect reporting officers to answer questions that don't fall within the remit of this group. Jill, did you want to?
It was just to say that we do have a protocol for working together clearly, and we would, you know, if we find a family that adults is working with where they're young carers, we would work with children's services. We absolutely do work closely together. And similarly, we've just established this new carers partnership board where we have representation from children's and from the young carers service. But it's just the level of detail of question that you're asking about their initiatives, and we're not able to answer at this point.
Okay. Yeah, Councillor Bingham.
Sorry, I just wanted to thank you for the case studies you put in there. Also want to say, if you want to have a chat about the CYCD thing, happy to have a chat afterwards of this.
Okay, I have a few questions. So on page 6, whichever page it is of the report, 67 in the agenda pack. I think Stephen mentioned the curators of change lived experience network. Have any more? You could flesh that out a bit, give a bit more details about what that is about.
Yeah, so I'm probably better to do that. So essentially, within adult social care, we are really expanding our aptitude and our ability to do more co-production. We knew that this was an area that we wanted to increase, and so as part of that initiative, we have engaged with an organisation through our Eastern ADAS colleagues, which is called Curators of Change. This is a group of individuals with lived experience, but who promote the practice and the skills in order to do co-production. So they are working with us and with officers of the council to bring in our local residents to support us in kind of starting a kind of really big initiative about working, and which includes local carers, to look at the information and advice and content and accessibility indeed of both our website based information and our paper based, so that we can improve those standards to meet the needs of our reflected of what our local residents want. So Curators of Change are helping to facilitate that, because they've got lots of experience, and that will strengthen our workforce for them to go on and do those initiatives themselves.
So the work we're doing with our fellow ADAS in the region, how important is that?
Well, it's absolutely vital. I think previously what we've had is a situation where the website and things have just been written by officers with no thought about how necessarily people might want to interact or use them, or have things phrased in the way that they want, or look and feel the way that they want. We know that there are improvements that can be made about on how we navigate our website, and I very much appreciate that not all of our customers will use the website, but we do need to increase that, and a lot of people want to, but actually some of our processes mean that you get so far and then you have to stop and then phone somebody up or then post something in, and we want to avoid that as much as possible. People that want to use that channel, we need to enable it. Obviously we keep other channels open for those who don't want to or can't engage with that channel for whatever reason, so it's a really important piece of work.
Yeah, obviously there's issues of accessibility, but the website certainly does look professional. It's easy, seems to be easy to use. In the actions, action 4.1.1, about the creating the support groups in the first year, and it's saying that the target is for an average attendance of 10, but how much impact is that going to have? Because as you've mentioned, we have over 1,700 registered carers in the borough. It's in 20 carers doesn't sound like.
Yep, 4.1. Sorry, yes, I got it. Thank you. I think we sort of against the numbers, I think it's how we promote the groups. I think we establish them, and obviously this is the initial sort of, we're saying they're the average attendance, but I think it's really part of year 2 is actually taking a step back and actually reviewing and developing existing support groups for carers. And I think this actually, so this particular one, which is obviously under priority 4, improving health and wellbeing of carers and access to mental health and emotional support services. I think this links back to where we want to target or offer, widen the offer, expand the offer, following the results of the National Carers Survey as well. We don't know what additional external factors may have sort of led to those responses. However, we feel that if we start to put these in place, particularly, I think again, that goes with sort of developing online modules and training as well for carers, so they can sort of share their experiences. I think it's about self-care for carers as well. But the actual expanding the sort of support groups, again, that's about social inclusion as well, to reduce isolation. But I think as the year goes on and as we receive our quarterly monitoring reports, we'll review as the year goes on.
Okay, thank you. 4.3.1, just below that, it's talking about monitoring the uptake of payments and of awareness of the carers allowance and attendance allowance offer. Is this something is this linked into what we've been talking about, identifying carers, or is it the fact that existing carers aren't aware of this, and what are we doing to make carers aware of what they're entitled to?
This will be existing carers are aware of this offer, although the idea is that we want to obviously further raise awareness as we identify carers and encourage them to have their personalised, tailored carers assessments in the offer. This particular one about the one-off direct payments, this is for something to support the carer for themselves to improve their health and well-being. So it could be a one-off purchase. Say, for example, it could be computer lessons. It maybe could be a laptop to help sort of like to widen their social networks. It could be a gym membership. But again, that's down to the tailored individual. But that will be part of the assessment and offer as they're undertaken.
Is that information, for example, is that information available on the website?
So this is not carers allowance or other things that are sent through national government. This is a specific. If you have a full carers assessment with adult social care, and it would be part of the respite offer. So what would be useful for you as respite? Now, for some people, we take their loved ones into our supported accommodation, and we look after them for overnight and give them a full break of people with very, very significant needs. For other people, they want just a few hours off and someone to look after their loved ones so that they can go out and do their shopping or wherever it is without having to worry. For other people, they say, well, actually, I get very stressed and I would like to go for a massage, or if I had access to a computer, then I could do more things online. I wouldn't need to love my loved ones. So it's more about that. This is the specific carers one-off direct payments that adult social care would give. They're usually for relatively small amounts, but they really make a difference to people's lives. So we wouldn't necessarily go, oh, you can get this. It would be if you need help with a carer, you can come and have a carer's assessment, because it's not about buying things off the shelf. It would be based on a very detailed assessment of needs.
So it's more about having a dialogue with the individual concerned.
Absolutely.
Okay. Thank you. There's nothing. Oh, sorry, Councillor Ambia.
Yeah. You mentioned on point 8, the thing is you arrange a dropping service for carers in Trinity Center and Lucy Community Center. I just would like to ask, do you do any sort of appraisal or review for the carer on after certain period? They are like how they are progressing, or if there are any support needed, like to review their performance or any sort of things. Do you have any any system in place? Thank you.
So essentially anyone who's had a full carers assessment with adult social care, now not everybody wants that. I'll just be clear. We identify a lot of carers and they say we don't need or we don't want a carers assessment. We make them aware of lots of informal support around and they're happy to use that, or they just say I'm fine, I want to look after my loved one. But for those people who've had a formal carers assessment with us, then yes, we would do, we aim to do an annual review with everybody. It doesn't always happen annually, but we do our very best and that's our target. And we're trying to work towards doing that for, for more and more people. So yes, they would be entitled to an annual review there. Otherwise, if they've not received a full carers assessment and support from us, then of course, at any time that they say, oh, our needs have changed and I think I might need some support now, then they are very free to contact us or Carers Central or through the other avenues that we've talked about and ask for that review.
Thank you.
Right, Councillor Nasser.
Thank you, Chair. Yeah, I'm just reminding what Councillor Ambia said about regarding the care assessment form, because in the past, I have came across actually, people when the assessment forms ask the question about financial, income, then people just the carer actually come backwards. Right? They don't want to enclose many things. They feel afraid. So I came across so many families, and then they doesn't want to go forward with the assessment. So that time we was told by the social service that they are trying to make it more simple and not asking a couple of question that people don't want to disclose. So at the moment, how is that assessment application form?
So we are in the midst actually of redesigning our carers assessment form. We've done some work on it, but we need to make sure that it maps then to the review form. So there's a little bit more work to do to tie that up. Carers are entitled to some support that is not means tested, and we would always offer that. So even if people didn't want to disclose their financial situation, then we can give them some non-means tested support. I think it more often happens, when they're assessing the needs of their loved one, where we really do need that financial support. So to give support directly to that individual does require a financial assessment with adult social care. It's a means tested service, but that's not the case for carers. We could offer some support without means testing, but obviously that's not the same level as a care package for their loved one.
Thank you.
Councillor Chowdhury.
Thank you. You may not have this information to hand, but just wanted to know, do we know how many carers we have within the borough who are known to us, so that going forward we know if we're sort of increasing our sort of take up of carers support by new carers. And the other question was around 4.4. Awareness of carers allowance and attendance allowance offer. Are we going to be only collecting data from those that we interact with through the to our known partners that are in the strategy, the Carers Lead, the Carers Central, and I suppose it's through our carers services. What about all our other sort of partners like Luton Access, Luton Rights, Luton CAB, who are doing the majority of these applications day in, day out? Are we collecting any data from them?
I think what's important really is it's actually about the reason why we've got the council's Carers Lead, Carers Central and Commission Service, and also when there's the Adult Social Care Communications Lead, is actually about raising that awareness to actually ensure that that people are aware of the entitlement to both the carers allowance and attendance allowance as well. And so the actual monitoring really is just to sort of see if we're actually getting out there, the message is out there for people and monitoring the uptake. Regarding your first point, Councillor, So according to the data that I have, so the total active number of carers who've accessed early intervention commissioned services in Luton as of July 2024 is 1,042. Again, this is also that's also linked in with our Carer Central service as well, who continue to they record, as I said, on a quarterly basis. I think they've got 1,778 on their distribution list to receive information. According to the census of 2021, there's an estimated 16,098 unpaid carers in the borough of Luton, and that equates to an estimated percentage of 6.47% of the local population is registered with the council, and 93.53% who are not. However, that's where this service comes in, and that's key for us in our strategy. So actually, sort of to ensure that not everybody wants to be identified. However, it's about we're sure that we get the information out. So if and when they do need that support, then they have the information to access it.
Okay, thank you. Okay. No one else is. Yes, go ahead.
Just in support, because this is a whole system issue. So you will have heard we talk about social prescribers. So I definitely know that the Luton teams are very much homed in and focusing. It's just about literally awareness raising. So I will equally make sure, because we've got some new personnel, so we'll make those connections. And also community pharmacists are quite good signpost and navigators. So again, I think it is about really, I'll use the GP bulletin, I'll use my means of communication, and we'll facilitate your work.
Okay, thank you. Okay, I think it's obviously a good thing that we have a long-term plan, and it's good to see that the plan is detailed and it includes designated actions and measurable outcomes and KPIs. There's obviously some issues have been expressed about accessibility to the services, which hopefully we can get to grips with. I think we're asked to note progress made to date, progress on a refreshed implementation plan with the measurable KPIs, and the survey of the adult carers findings. So I think we can do that. And it would be good if you could come back, say, this time next year with an update on progress of the plan. Okay, thank you. So we move on to item number 9. Update of the JSNA overview for 2024.
Hello, good evening. I'm Alaman McKeith, Intelligence Manager at the Council here, and I'll talk through the Joint Strategic Needs Assessment Overview, which we've updated recently. The Joint Strategic Needs Assessment is an analysis of the current and future essentially health and social care needs of the population. There's not one way of doing the JSNA. There's multiple reports, topic-based needs assessments, tools such as Social Progress Index, which I've presented to some of you a few months ago, and many of the reports we have on the Luton Observatory website. What we've done with the JSNA overview is bring together key indicators into one report. It's heavily weighted to health and social care, but also we have extended it and its design and contents last year in 2023 to be aligned to the Luton 2040 ambitions and targets within that. So it has what we call wider determinants or indicators that are not necessarily directly health, but do impact on health and social care. So I will be talking through the exceptions in terms of performance, those that we're doing not so good at, areas of concern, which I've titled, and those that we are actually doing better. In terms of page references in your packs, the full JSNA is between pages 84 and 276.
that is the document that will be eventually published on the Luton Observatory, and following those pages 277 onwards is the exceptions. Just a bit about the design of the document. There's more than 100 indicators in there across all of sort of the stages of life, and the Luton 2040 targeted measures. Most of them have been updated in the in this version that you have. Some data isn't available, which are publicly available data sources, and they haven't been made available, and we'll update them as soon as we have them. But the vast majority of indicators have been made available. Most of them are from publicly available robust sources, such as Public Health England and various government agency websites, and some indicators are from our own internal systems. For each section, it's a fact-based, just a presentation of facts. It's not a performance report per se, where we're looking at to get commentary from lead officers or responsible officers. It is just a presentation of facts where people like yourselves and other leaders in the town, those who are in charge of policy development, service delivery, can use it as an evidence base to design services and to deliver services. So it's a presentation of facts as they are. And what we've done for the Luton, they're at Luton level, so it's not down to ward level. We have other analytical products that are down at ward level, but this is at Luton level outcomes. We've put in there where we can trends, so you can see some historical data and where things are going, and then some comparison to put the performance into context. So comparison against the what we call the England average, the Eastern region average, and then statistical neighbour average, which just gives us an idea of where we are in comparison to others. That's a bit of an overview of what the document is. The design, like I say, came in last year, and this is the first annual update of most of those measures. I think I'll go over the areas of concern then in that case. I did want to share the document on the screen if it's possible. If not, I can I get up on the screen?
I sent.
Just trying to find out.
Yeah, so you can present it on Teams, then you'll show up on the screen.
Okay, so hopefully that shows up. I'll just run through the health ones to start with. So we've got the different life stages. So yeah, these are they've been picked out as a concern if the criteria I mentioned before, it's either getting worse in and of itself, or it's worse against one of the benchmarks, or a combination of those. And if it meets that criteria, I've picked them out from the main report into this slide deck. So rates of infant and child mortality is still significantly higher than the national regional averages. Babies born in Luton are of low birth weight is still significantly higher than both national and regional averages. Percentage of 2-year-olds in Luton receiving vaccinations is significantly worse than the national regional averages. 5-year-olds experience visually obvious dental decay, again, is significantly higher than both national and regional averages, and with no significant change in the last 3 years. Rates of hospital admissions for substance misuse for those aged between 15 and 24 is significantly higher than both the national and regional averages, although it has in the last year, it has reduced in the last year. So there are some signs of improvement. And the percentage of year 6 children, so that's the school year 6 children classified as overweight or obese in Luton is significantly higher than the national regional averages. So that's the children. Moving into adults. Adults currently deemed to be physically active is significantly lower than national regional averages, and then Luton ranks 15 out of its out of 16 of its statistical neighbours. So the report itself does state who the SIP for statistical neighbours are. These are it's a well-established statistical group consisting of authorities like Bradford, Slough, those who have social demographic similarities to Luton. So we compare against them, and we are one from bottom when it comes to physical activity in that group. Prevalence of diabetes amongst adults is significantly higher as well against the England average and East of England average. And again, smoking rates are higher in Luton compared to both England and Eastern averages. In terms of the older population, the first 2 points are regarding screening rates, and screening rates have been falling for breast cancer, cervical cancer, and bowel cancer for a sustained period. Obviously, for all of this, there's more information in the full report. And the under 75 mortality rate for circulatory diseases considered preventable in Luton is significantly higher than the regional averages. Life expectancy for males and females remains significantly lower, and the current rate of all-cause mortality under 75s in Luton is significantly higher against the national regional averages. And in terms of social care, just in terms of demand there, we've seen an increase in new requests for support since 17-18. So there's more demand coming into adult social care. Over to the areas that are improving in terms of children's health, we see percentage of mothers in Luton that are known to be smokers at the time of delivery is lower than the national regional averages, and a sort of sustained decrease in the last 3 years. And in the older population, emergency hospital admission for falls, injuries in persons aged 65 and over is similar to the regional rate, but lower than the national rate. And Luton has the lowest rate in our statistical group. Hip fracture, the rate of hip fractures in people aged 65 and over Luton is similar to both the national and regional averages, but the lowest in the SIPFA group again. And the estimated dementia diagnosis rate in Luton is significantly higher than the England and East of England comparators, and ranks first out of our nearest neighbour group. So some good news there. Just to quickly move on to what we call here wider determinants, but all of these issues are really interlinked with one sort of health and well-being. Child poverty rates there are still remains quite high compared to England rate, as you can see there. A little bit there on our minimum income standard, but you can see that so what we call financially destitute has increased since before COVID, since after COVID, almost doubled the proportion of people that we would consider financially destitute. The number of people earning below the living wage is increasing, but it's still a problem, the number of people earning the living wage. I'll just leave that up there for you to scan, and then maybe I'll move on to the next slide. Some of these are known. It hasn't changed from year to year. We're still below the benchmarks where we should be. Housing is a problem as well. Housing affordability there at the bottom. So these are the ones getting better. So emissions are down, and we do very well, Luton does, in terms of its emissions measurements. Again, electric vehicle charging points, there are more around town. Fuel poverty levels are reducing. Number of our pupils attending good or outstanding schools is higher than national statistical neighbours. And a couple of others. I'll just leave that up there for you to scan. Is that okay? Thank you.
I think, yes. I mean, where were you going to go on, or is that? Sorry, you finished. Yeah. Sorry. Yeah. I think. Yeah. I think we get the. I assume everyone's managed to look through the report, so we should all know what the report is telling us. Does anyone have any questions? bearing in mind that the officer might not be able to answer any particular question to do with the detail of, you need to talk to the appropriate officers. Councillor Hussain.
Yeah, I mean, it's very depressing. I've been seeing that for years and years, and there are people sitting in this room that do know that I've showed my concern more than 10 years. And looking at these figures, and you've given us the facts, it doesn't tell me that we've made a huge improvement in public health, or in terms of every page that you've shown, whether it's the children's health, adults, it's going, down worse to worse. And it's nothing to be proud that we are above the English average or other eastern regions. The question I really have is in child poverty. I mean, the figures I saw sum up the area where it has gone up considerably, particularly in the ward that I am in, Farley, Dallow, Biscuit, and Hightown and Southey. The figures are far more than 60 and 70 and above. But is that 39% the average for the whole town? I got that right? Yeah. For some areas that were
That's correct. Poverty levels are higher in certain areas like Marsh Farm and Farley Hill, etc.
Not sure if Director of Public Health is here today or not, but I'm hoping that we would get a report sometime in the future that would tell us what are we doing. Each of these, at least we should be making some progress and not really going above the national, regional, or our statistical neighbours. And what initiatives are we using? These are relevant questions, not to the person who's given us the information. It's for the people that are responsible for public health.
Thank you, Councillor Hussain. Concerns, I think we share all those concerns, and they've been noted, and I'm sure there is an appropriate forum for those to be raised. Anyone else? Councillor Chowdhury.
Just one question. You've got in your report percentage of 19-year-olds achieving at least a level 2 qualification is continuing to improve. Is there any reason why we don't collect that information or show that information for 16-year-olds? I mean, that's when we would have thought that they would have attained a level 2 qualification. I mean, isn't it at 19 it's level 3, isn't it?
Yeah, I'm not entirely sure why that is. I think with obviously up to 16 would be the GCSEs, which we have put in there, which is comparatively worse at GCSE rate at that level at 16, and then maybe after the colleges when they're starting work is why we've put level 2 in.
According to national averages?
So what we call the average attainment 8 score, which is the average GCSE score, has now gone down for 2 consecutive years. The last 2 academic years, it's gone down. We don't have obviously the last academic year, so the previous 2 to that, we don't have those results yet for the one that's just finished, the summer that's just finished. But for the previous 2 years, they've gone down 2 years in a row, and they are lower than England, Eastern average, and the SITFA benchmarking. So that's at 16 GCSEs.
Right, okay, thank you.
Hi, I understand Sally wanted to come in there.
Thanks. Yeah, I just had put my hand up in response to Councillor Hussain's comments. So obviously, as Alamin has been very clear that this is the facts, this is the joint strategic needs assessment just shows the data, and as you rightly say, he can't answer for what everyone's doing about it. But what it really does is show where we still need to do work, and yes, absolutely recognise that a lot of these measures haven't shifted in the right way or as much as we would want for years, but a lot of them are very complicated, so there's not just one thing that we can do to address them. But what they do is lead forward into our population wellbeing strategy to ensure that we're focusing on the right things. So for some of the public health ones, for example, we've got a really comprehensive whole system physical activity strategy that we are absolutely prioritising, and we have seen a slight improvement in the last year. And obviously we'd want to see that improve even further. Obesity year 6, that's an absolute focus. We've seen some really good improvements in reception, and now want to really maintain that focus to pull through and start to see the decrease in year 6. Child poverty absolutely is the whole purpose around 2040, and is what we're all trying to come together on, poverty overall, but child poverty particularly. So all of the strategic work that we're doing across the council and across partners is aiming to address and tackle children and families living in poverty. So it's a really complicated issue. But what we're trying to get better at for this joint strategic needs assessment is the read across to population wellbeing strategy measures, which I think I presented the update on that in the spring. A lot of the measures that are in that now are the same that we're looking at in the JSNA, and also the same that we'll be starting to pull through into our 2040 annual reporting as well. So we're trying to get much better at that read across so that we are collectively understanding what our issues are and driving forward the work programmes. So there's various things that come through to this board that talk to some of these priority areas over the course of the year, and we've brought various things previously. So it does form the work programme that this board then sees over the course of the year.
Councillor Hussain?
The question I'm asking really is that with our statistical neighbours or neighbours in the region, deprivation in similarities in other towns, you know, whether they are in the Midlands or North or up in London boroughs, you know, where we have it, where people have made the improvements in these all these in terms of the public health. What is it that we are not making even a tiny amount of progress in those things? And that's what concerns me, that it being first on something is not something that I would have liked to have seen. After all these years that we have put a different initiative, we need to target, you know, at least those that are probably the worst, and then, you know, work our way. You mentioned about 2040. Yes, that's a brilliant thing, but I'm talking about today and the years to come in terms of the health of the, and, you know, whether it's a life expectancy or, you know, if they can do it in Gateshead, what is it that we are not, that we can't do it? This is what I'm talking about.
Okay, so I think our statistical neighbours, they're obviously as similar, the most similar, but they won't be exactly the same. So there will be all different challenges across different ones. And they probably have been having similar conversations year on year. I always think of Slough, for example, as one of our statistical neighbours often. They would have been battling with obesity, tobacco, poverty, and having long-term conversations as well. And I don't think we're always the worst in the pack, and different indicators will sort of flip and be, you know, comparatively in a different ranking compared to them. So we're not always the worst in all of them, and we won't be necessarily seeing a different trend to them either. I think we'll be battling with a lot of the same issues.
What I'm asking for is that if we can compare, you know, there wouldn't be any neighbourhood exactly the same, but say we're looking at Leicester, we're looking at Slough, which is, you know, predominantly large ethnic minority communities. Yeah. So if we can compare those in terms of the progress, and deprivation would be not probably exactly the same, but if there'll be some areas there will be, you know, a similar sort of deprivation. That would be more for us to be able to see where we are and what we can do to improve these, you know, where we have the worst problems. Yeah. So it's not, you know, it's a long-term strategic thing that we are looking for. We've been talking about it. We've done a number of initiatives. We did bring down life expectancy in terms of the female, improvement. or something has gone in between that it's gone down. So I just wonder, what is it that we need to do different?
Well, we can have a look at some of our statistical neighbours and see whether there's any other learnings from those, or where there's where they're doing better and we're doing worse, and if there's any particular learnings or particularly indicators that's relevant to. So we can take that away and have a look.
Thank you. Is there anyone else? So just have a couple of questions about what's in the report. Is there any consideration been given to including the effect of population churn on some of these measures and some of these outcomes? And is there would it be appropriate to include that in the JSNA?
I'll try and answer that, Sally. Sally, I'll let you come in. I think it's evident in some of the outcomes, actually, the population churn, in terms of, we've had quite a substantial increase in the population overall in the last few years and since the census. And I think you can see that through some of maybe the housing metrics, where the housing affordability ratio, for example, is worsening. Usually in most authorities, you have more houses and the population tracks that, but we haven't had that. We've had the population go up, number of households or new dwellings hasn't, as I've stated in the report, and that's actually causing more housing problems. So through a lot of the metrics, actually, it is, maybe just need to clarify what I mean by population churn, or people coming in or going out of the town. But in terms of the overall growth of the population, I think it comes through in the metrics. Alongside this, we have done some population modelling work in terms of breaking down the population by age and ethnicity, and how we think that's going to grow in the future up to Luton 2040 and beyond, which we can share with you if I've understood it correctly, your question. Sally, I think might want to come in.
Yeah, thanks. And Katie's put her hand up briefly as well, so you might want to also come in. We do know that population churn for some of the health, primary care particularly, measures is a challenge. So when it can inflate the denominator. So if people haven't deregistered from a practice and that hasn't caught up, and we know that people kind of don't stay for that long, and then the list size might be inflated. So we do know that that's a problem, but it's quite hard to quantify. So I think just some recognition that may well be a challenge for some of the primary care data particularly. And we did do a bit of a deep dive on that a couple of years ago, I think, didn't we, Katie? But I don't know, did you want to come in at all on how better we can include that?
I think probably most people have covered everything that I was going to cover. So Alamin has obviously mentioned that we do population analysis, where we look at the population churn overall in terms of the migration, internal and external migration. So that does feature as part of what we look at in terms of other products that we produce that are on our observatory. And yes, we have looked at population churn before. It's quite difficult to actually quantify, like Sally says. So where we think it does have an effect, we're able to put that forward in more analysis that we do. But population churn will affect different issues in different ways. So it will apply different ways to some of those measures. So I think that's where that population churn work will really add value, is when we're looking at those issues in more depth. I think the JSNA as it is quite high level. So I think when we are examining those issues through further analysis, which we also produce, we can talk specifically about how the population churn might affect those levels. But yes, it is very difficult to quantify, and we have looked to use things like GP registers in the past to quantify this, but as Sally says, it's quite difficult because people don't deregister from practices. You don't always have a really clear number of exactly how many people you've got or how much churn you have in each of the areas over time. One of the challenges that we're still developing is understanding a level of population churn or stability in some of the ward areas of Luton, which I think will be an ongoing piece of work for us to try and do that a little bit better. But also is a bit of a challenge in getting the data in to support that work, so how we can bring that together to understand that churn in more detail.
Okay, Thank you. It just strikes me that if you're having snapshots from one year to the next, and say 10% of the population is not the same over those 2 years, then does that invalidate the results in any way, or does that influence the results in any way?
I think Alamin wants to come in. Sorry, I wasn't sure who you were asking that to.
I just wanted to say in terms of the statistical outcomes, it will just be adjusted for population differences. So we will monitor the ONS's population, and a lot of the statistics you'll see will be adjusted for the population differences from one year to the next.
Okay, thank you. Thanks. But how about, you've got a whole range of individual separate measures. So again, because it's a snapshot, it's perhaps not appropriate, but is there any way of measuring information about the interplay between some of these factors, say like between emotional health and physical health, and how that's influenced by housing, employment, etc.? So, Katie,
Yeah.
Sally's-
Sorry, I was
Go ahead.
just going to add. So the JSNA summary is really as a document to identify what the needs are for the town, and once we've identified those needs, as Alamin's alluded to, where he's highlighted some of the exceptions, what we do is you take that forward, and some of those areas will have more detailed needs assessment. So things like cancer, we're doing a cancer needs assessment at the moment, which really looks at that level of much deeper dive into what's actually affecting it, what's driving some of those changes, which will answer some of those questions. So when we finish the needs assessments, we publish those on the website along the JSNA. So the JSNA can be regarded as a whole suite of products that all add to the understanding, and this JSNA overview that you've got presented here is just one part of it. But the aim of this document really is to identify where we need to be looking further, and then we provide that further analysis that looks at the interplay between different factors in later documents. So the cancer needs assessment will be considering factors as an example of other factors that do relate to it, and I imagine that population change would be probably one of those as well. But that's the aim of what we're trying to achieve with the JSNA and the products that are linked to it.
Okay, thank you. Sally, you got your hand up.
I do, yes, thank you. I was going to say something similar or related to what Katie said, that some of those interrelations would be brought through in the needs assessment or the deep dives that we might do on a particular topic. But your example of physical activity and mental health being interrelated, absolutely. So when we've done the needs assessment that's led to our physical activity strategy, we've kind of linked in the mental health work and vice versa. So we know when we've got a mental health prevention work stream that the people that are leading on physical activity would be part of that as well. And we recognise that interplay. So it would come through at a later point or in a deep dive. Similarly, Alamin mentioned infant mortality, and one of the indicators that's not going in the right direction, and low birth weight is also not going in the right direction, but is linked. So we're doing, a wider analysis piece around infant mortality, and low birth weight will come up, and that interplay between the two, and smoking in pregnancy and all of those other risk factors that will cause that will all be looked at as part of that. So it's that deep dive needs assessment approach where that will come through more.
Okay, thank you. Yep, that all makes sense. All makes sense to me. Does anyone else want to contribute? Councillor Ambia.
Thank you, Chair. On the report, you have mentioned on starting well section about child dentistry. However, on the living well, and the dentistry topic is missing, and we have a big issue across the all over the UK about dentistry, and especially in Luton, lots of people unable to get access NHS dentist appointment because of this dentist. They are not accepting any more patient, or even like existing patient, they withdraw their name if they don't visit regularly. And I have experience to speak one of the dentist, and I personally requested what is the issue, why they are not accepting NHS patient. I think I mentioned he highlighted main thing is there's too much bureaucracy about, like, process is too much complex, too much complex. So that's why he gave up NHS contract and he focusing on the private patient. I believe Nikki is in here. I know ICB been to this structure. Is there anything you can make it? Is there anything you can take any initiative for dentistry? Like, I mean, that could encourage the dentist to accept NHS patient, because from the dentist perspective, they find too much complex procedures or too much bureaucracy to get to accept this NHS patient. If you can make a comment, please. Thank you.
I'll come in there. So you're absolutely right. It's myself and my team that commission dental services. It is a national contract. So there has been, it's probably easier if I do a bit of a briefing next time, but just as an illustration, dental practices, unlike GPs, don't have registered lists. So you access a dentist if they've got capacity. And when you then have a course of treatment, and when you complete the course of treatment, you are then not on this. That's the national contract. I am happy to be quoted. The national contract for dental is known not to be very effective. And I know that there's national, work reviewing that. So there are costs for units of dental activity. They are universal. So, I mean, I can give you all of that briefing. We have in Luton in particular, very much working with Sally and her team. It's about oral health. So access dental is part of the oral health work. And we have commissioned some additional capacity exactly for that basis, and equally for where people are in pain. So it isn't ideal, it's marginally better. We've been accountable for dental commissioning since 2023. So, yeah, I can give you some more if you want, but that's a bit of a highlight.
Sally, did you want to come in?
Yeah, Nikki said most of what I was going to say, actually, but it was just to mention that the statistic that's in the JSNA is the 5-year-old visible decay statistic that's really good national data on, and it's collected through survey, and so that's what we present, because there's robust data on that, and that's not about dental access, that is about oral health, and is an indicator around how well it has massive implications for children's well-being. So attendance at school, pain, it's a kind of an indicator of deprivation as well, and impacts on obesity as well. So it's a really important indicator, and really vital that nationally it's collected well, and that we can look at that locally and say, well, we really need to do more work in this space. And as part of that, we then have an oral health strategic plan that, as Nikki says, one of the actions, or one of the key things that as a partnership around that we look at, is dental access. So it's a driver of oral health, rather than that's the dental access is the indicator that we look at in the JSNA. So absolutely, dental access is important, and part of the work that we're doing is a wider strategic piece around oral health. But the indicator around oral health that is the best one to look at as a measure across the population is that 5-year-old visible decay.
Thank you. Oh, sorry, Councillor Ambiad, please. Yeah.
Thank you, Chair. I have just follow-up question. Nikki mentioned about is a national framework, and there is a national issue. I know the BLMK ICB. Are you not able to take initiatives locally, like through the BLMK ICB, instead of looking for national framework? Is there
Councillor?
anything you can do this like ICB as a take any initiative?
Sorry,
Individual.
can I come in here? This is not really directly to do with relevant to the item in question. So do you want to take your query offline outside the meeting?
Okay.
Thank you.
Thank you.
Councillor Chowdhury, please.
Just one thing very quickly. In terms of child poverty, what are the metrics that you're looking at? What sort of data are you looking at in terms of calculating child poverty and how well we're doing or how badly?
Yeah, so we've got our own minimum income standard where we're looking at, it's quite a detailed local data sets that we've got on that. So family income, family composition, number of children, type of accommodation, private renting, for example, you're more likely to live in poverty. So it's quite a detailed, the MIS, minimum income standard model is quite a detailed model where we're looking at local and right down to cost of things, foodstuffs, school uniforms, right down to that level, and how much a family has, how much income they have, what their outgoings are, and we can work out what they are. In terms of the child poverty one, that's obviously an independent one, the one with 39%, 40%. That was done, I believe, by the Child Poverty Alliance with the university. So that's a separate independent measure. But we have our local measure as well.
Thank you. That's all then. Right. To sum up, notwithstanding the content of the report, and it's obviously illustrating, I think it obviously illustrates very well some of the challenges that we face and what we're doing well. But I think the JSNA in itself is a very impressive document, and as I say, it shows us exactly what the challenges are and what the areas we need to tackle. I think we're asked to note the report, so I think we can do that. Okay. If we go on to the final item, the HSCRG draft work programme. Okay, so I am happy at the moment with the draft programme. The next meeting on the 22nd of October looks quite busy, so we might want to consider at some point perhaps moving or delay or putting back something from that meeting. If there's anything that anyone would like to bring up, have reported on in a forthcoming meeting, then let myself or Democratic Services know. Okay, if there's nothing else, then